Hello, everyone. Good evening. Welcome, welcome tonight to MS Neuro TV, everybody. Tonight, we've got a great topic. We're talking about migraines tonight. We're talking about different types of headaches, and we're talking about multiple sclerosis in relation to these things. So every month, we try to pick some interesting topics that can help people that are living with these specific things. We hope tonight's topic is helpful to a lot of you. Some of you wrote to me earlier this week and said this relates directly to you, so I'm really glad to know that. My name is Jennifer Falk. I'm the Director of Development over at MS Views and News, and tonight we have on the line with us Bill Shanley, who's our productions manager, and Dr. Daniel Kanter is going to be joining us a little bit later. For those of you who have been with us before, welcome back. And for those of you who are just joining us for the first time, welcome to MS Neuro TV. As I said earlier, we do this every month. We select a topic that we think can help a lot of people, a topic that's interesting, a topic that we can get new information on, and we try to share as much as we can with someone who knows a lot about that topic in the MS world. And tonight, that will be Dr. Daniel Kanter. And just to give you a little bit of background, MS Views and News is a nonprofit organization dedicated to providing education and information to our multiple sclerosis community. And in case any of you don't know, today is Giving Tuesday. Happy Giving Tuesday, everyone. And if you have enjoyed our webinars for the last 2 years that we do every month, or you have had the opportunity to go to any of our live programs or receive our newsletter, please know that all of the work that we do is done through donations and through support through viewers like you. And we are hopeful that if you are able to, please consider giving a charitable gift at www.msvn.org for Giving Tuesday. And we thank you for that. Any gift is a good gift and can help support the work that we do all year long. And we would also like to thank our supporters this evening, which is Celgene and Sanofi Genzyme, and for viewers like you who make educational programs like tonight possible. And so tonight I wanted to introduce Dr. Daniel Kanter and give you all a little bit more information about Dr. Kanter. Dr. Kanter is President and Emeritus of Florida Society of Neurology and the founding president of the Medical Partnership for MS. And he is an active member of the Healthcare Advisory Committees of the Multiple Sclerosis Foundation, the Multiple Sclerosis Association of America, the MSAA, and of MS Views and News. Dr. Kanter is the Chief Medical Correspondent of MS World, and he is the co-scientific director of the largest US-based MS patient registry, Corona MS. Dr. Kanter is past chair of the Florida Medical Pharmacy and Therapeutics Committee, past director of the Comprehensive MS Center at the University of Florida, Jacksonville, inaugural Neurology Residency Program Director at the Schmidt College of Medicine at Florida Atlantic University, and past chair of education and board member of the Southern Headache Society. Dr. Kanter is board certified in both neurology and headache medicine. So we are very lucky to have Dr. Kanter joining us tonight. I think that he brings so much information about headache and MS to us, and we are very happy to have him. Earlier this year, Stuart Schlossman, who's our founder of MS Views and News and also someone living with MS, interviewed Dr. Kanter. And we're going to start that interview playing for you in just a minute. And yeah, I hope you guys enjoyed this video and this interview, and we'll be back with you right afterwards live with Dr. Daniel Kanter. Okay, Bill, let's play the video.
Neuro TV, presented by MS Views and News. MS Neuro TV is a comprehensive educational program bringing together MS professionals from across the United States covering the topics that you want to learn more about. To register for MS Neuro TV webinars, visit www.msviewsandnews.org. Thank you. We hope you enjoy the program.
Welcome to MS Neuro TV from MS Views and News. And my name is Stuart Schlossman. And again, we do this every month. And this month, we're going to have Dr. Daniel Kanter. And Dr. Daniel Kanter is a migraine specialist. And, I want to thank you for being here tonight and for teaching us more about this important topic of migraine. So my first question for you, though, is can you please tell us what a true migraine is?
When people think about migraine and when they think about multiple sclerosis, a lot of times things get confused. And actually, one of the things I ask people, I say, what is a diagnosis where it's mostly genetic, where it's women more than men, younger a little bit more than older people, and a quarter of some people, there's actually white spots on the brain. And a lot of people will jump in and say multiple sclerosis, but the actual answer is migraine. And so what we think of as migraine is we think of it as a type of headache, but it's more than just a headache. But when people say that they have a headache that's severe or that's moderately severe, that's impacting their life, that's impairing their physical abilities, when they say that the headache is bothering them when they can't see light and light's bothering them, or the sound and they just don't want to be around that, or when they feel like they want to vomit or they actually vomit, those are the sorts of things that lead to a diagnosis of migraine. But migraine is a primary headache disorder. And a lot of times when we're thinking about classifications, and we do that in medicine, we like to classify things and give them different terms. It gives doctors things to do, but it also helps make sure that we're using a common language. And when we think about that common language, we talk about primary headache disorders and secondary headache disorders. And although migraines for some people can be really, really bad, you'd rather have a primary headache disorder a lot of times than a secondary. Because a secondary headache disorder means it's secondary to something else. So a brain tumor causing a headache, well, that headache is secondary to the brain tumor. A migraine is primary. That's the condition that you have.
So are migraines hereditary?
There's a large component of biological, hereditary, genetic basis of migraines. It looks like it's not one gene or two genes or three genes. It looks like it's really a lot of genes together where it puts you more at risk for having migraine. We talk about that when we talk about a lot of conditions where there's what we call polygenetic risk, where there's lots of genes that together put you at a higher risk. In some studies, when a person has migraine, 70 to 90% of people actually have some family member with migraine as well. So that's a lot. And in other studies, when you look at a mom and a dad who both have migraine, well, there's a 90% chance that their child will have a migraine. So migraine is genetic, and it's actually a lot more genetic than some of the other conditions that we deal with.
Do foods cause a migraine?
When we think about foods and migraine, we think about something what we call triggers. And a trigger is something that takes a person who's already a person who has migraines, we call them a migraineur or a person with migraines, and it makes that migraine happen. It triggers it to be happening. So some things that can do that are lack of sleep. If somebody was taking too much caffeine and suddenly stopped caffeine, well, that can do that. And some other people actually taking caffeine or taking other foods. Some people think that things like chocolate are triggers. And then there's other ones where we're not quite sure. So for example, chocolate, some doctors think, well, it's not actually a trigger. It's actually that right before you have the migraine, you actually start to have kind of a increase in your appetite for sweet, sugary things. And so you eat the chocolate, and then you think, oh my God, the chocolate caused the migraine, but it wasn't really the chocolate causing the migraine. It was actually what we call the prodrome, the symptoms before the headache come on that made you want to have it. Then there's other foods like MSGs. I remember growing up, I couldn't eat hot dogs or cured meats because the MSG in there would just trigger a headache, would trigger a migraine in me.
What about stress, or what about using a computer and seeing all the digital aspects that go on screens and all the lights and the formations and whatnot? Could that cause a headache?
We live in a really dangerous world now. We're not living in a world where we're being chased by lions and cheetahs and other sorts of things, not in the United States at least. But we live in a dangerous world because we're being exposed to things like these computer screens, like these tablets, like phones that are glued to us all the time. And having all those different kinds of light stimuli actually can trigger in some people a migraine. And stress, absolutely. Stress makes everything worse in our health. It's hard to separate stress from what's going on in the rest of your life. But stress in a person who's already prone to migraines is going to make that migraine come out even more.
Thank you. What about, what are the different types of migraines? I mean, I know, I've got optic migraine a lot, but what are the other types of migraine?
There's been different classifications and different terminology that we've used. It used to be that people talked about something called a common migraine and a classical migraine. And then sometimes people talked about migraines with aura or migraines without aura. And aura are things that come right before the headache part of the migraine, and they're almost like a warning sign. The most common type of auras are actually the visual auras, and that's the kind of the most famous ones, where people see something like a fortification, or they see stars, and they see these things start to expand. And that we call a migraine with aura. It's actually interesting because people think, oh, well, that's, if I don't have that, I don't have a migraine. Well, actually, no. That's actually called the classical migraine. The common migraine, the more common migraine, does not have a warning sign beforehand.
Is that the prisms that are involved?
When people have that warning sign, some people see it as, some people have described it as prisms, some people have described it as stars, some people have described it as like kind of the castle that you think of, like those medieval castles where they see that stuff, or a kaleidoscope.
Right. So what are the, going forward, is migraine associated with people with MS, or is it just people with MS also have migraine?
So if you look at the world of people, 99% of people have ever had a headache. And then you look inside that even smaller and you start to say, well, how many people have had migraine? And about 10 to 12% of the population in most populations in the world have migraines. Now, that means that there's a lot of people with migraine in the United States. So that means that you're having about 40 million Americans who have migraines. That's a lot of people. And then if you say we have 450,000 to 1 million people with multiple sclerosis in the United States, well, that's a smaller number, but some of those people are going to be overlapping. So I think that for some people with multiple sclerosis who also have migraine, it's just because migraine is very common and MS is not very rare, and so you might have both. I do think there are some people where it's actually a part of their autoimmune disease, where actually the body is attacking itself, and one of the ways it attacks itself is by causing those migraines, and it causes that inflammation and that swelling that's going on. And so the jury's still out exactly on, does MS cause migraine? Migraine probably doesn't cause multiple sclerosis, but the jury's out on whether it's a common symptom of people with MS or not a common symptom of people with MS. Now, there are actually some of the treatments that we use, especially the older treatments for multiple sclerosis, that actually could trigger migraines. Could take a person who has migraines and be a trigger for them to have another one. And obviously, somebody with multiple sclerosis who also has migraines wants to make sure to talk to the neurologist about both of those conditions, to make sure that they're not taking something that can make one worse.
Good, thank you. How do migraines impact a person's life?
Migraines can really impact a person's life in a lot of ways. Many people probably watching this have heard that multiple sclerosis is the most common disabling neurological disease of the young that's non-traumatic. As an MS and migraine specialist, I actually think that migraine is the most common non-traumatic disabling neurological disease of the young, because there are some people who can be really impacted. And when we're talking about types of migraines, besides what happens in the migraine, there are some people who have migraines every once in a while, and there's other people who have them more than 15 days a month and even daily. And that can be really troubling. Imagine trying to work, trying to function, trying to go to your relatives, go to weddings, go to the graduation of your nephew, but you can't stand light, or you can't stand smell. Or when people are touching you, it feels really sensitive. That's something called allodynia that some people with migraine have. So migraines really can be very impactful in people's life and can really impair their functioning.
Or looking into bright lights.
Mm-hmm. Yes, we are.
Exactly. So how does a person know the difference between a normal headache, a cluster headache, a migraine headache? I mean, there's so many different terms for headaches. I mean, how do they know when it's really a migraine?
It's interesting because a lot of people think that, oh, I'm not as impacted as that next person, so I don't have migraines. Meanwhile, that person has the headaches that are lasting for 4 to 72 hours. They're affecting one part of their head more than the other. They're having light sensitivity. They're having sound sensitivity. They feel a little bit nauseous. They probably actually have migraines. There is one easy way. There's something called pin the diagnosis. So if somebody has photophobia, meaning that light bothers them, if they're actually impaired, if it's bothering the way they're functioning, and if they're having nausea, if they have 2 out of 3 of those, well, it's probably a migraine they're describing. People don't usually go to their doctors to talk about other types of headaches, except if it's a headache that's being caused by something else, like those other types of secondary headaches. And so when a person goes to their doctor and they're complaining about their headache, I, as a physician, almost know that they're probably not describing what we call a tension-type headache. Because a tension-type headache, you take over-the-counter non-steroidal anti-inflammatories and they go away a lot of the time. But a person with migraine is really being bothered by the headaches that are happening. And that's why it's important to talk to your primary care provider. It's important to talk to your neurologist, or even some of us who are board certified in headache medicine. And that's what we do as a specialty, is we actually look and make sure, well, what type of headache are we talking about?
So you brought up a great topic right now. And the next thing I wanted to ask you, if a person knows that they have a migraine, how do they prepare? What do they go to their doctor about? How do they prepare to speak with their healthcare team about this?
When you're preparing for an office visit, whether it's for multiple sclerosis, whether it's for diabetes, or whether it's for migraine, it's important to bring the information that physician is going to need. And when it comes to migraine, one of the things the physician is going to need, or it's going to be helpful for them, is actually something we call a migraine diary. So a lot of doctors talk to their patients about keeping those, at least at the beginning, to have an idea of how often is it happening. Because when you go to that doctor's office, it's almost like you're staring into those lights, right? It's almost like a deer in headlights. You suddenly forget everything you were going to tell them about. And you say, well, I have headaches. How often? Well, I'm not sure. If you kept a diary for a couple of weeks or for a month, then we have a better idea of how frequently it's happening, what's it impacting. Are you having to take over-the-counter medications? Are you having to take prescription medications? What things are you missing in life because of them? And so I would make sure to let the physician know how frequently the headaches are happening, and also how they're impacting you. Because that physician that you're seeing may not be like many physicians, may actually not have headaches themselves, and they may not be able to fully understand. And one of the things about headache is it can be stigmatizing. You know, people say, oh, that person has a migraine, they're just, kind of just making excuses. We even use that as a society as an excuse. We say, oh, not tonight, I have a headache, right? It's a joke that we use in society. But headaches can be really, really troubling. And when you don't have it, you don't know how bad it is. For me even, and I've had migraine since I was a child, when I'm not in the middle of a migraine, it's hard to remember how bad it really was. Because when you have it, it can be so bad and it can be so troubling.
Great. So last question I have for you is, what are today's treatments for migraine?
It's an exciting world we live in terms of the therapeutic landscape or the treatments we have for migraines. It used to be that we had few medications, and now we have more. And now we even have medications that are being developed specifically for migraine prevention. That's an exciting time to be in. So if you think about the treatment of migraine, it's important to think about prevention. What do you do to prevent having migraines? And it depends on the physician that you see, and depends on how bad your headaches are. But a lot of us think if you start to have 2 or more per month, then it might be a time to do that. If you have one really bad migraine month, maybe it's important for you to also be taking something to prevent it. And then we think on the other side about abortifactive. What can we do to stop the headache when it's happening? And then in the middle, we think about rescue treatment for the migraine. So when we think about prevention, we used to think about things like some of the anti-epilepsy medications. So we use something called divalproex, so sometimes called Depakote or Depakon, are medications that we use, but they had problems. There could be weight gain, there could be problems with giving it to women, especially childbearing potential, other kinds of reasons why you might not want to do it. We use another medicine called topiramate, or also called Topamax. And that medication was developed actually, at first actually as an anti-diabetes medicine, didn't work for diabetes, worked for preventing seizures, and then they noticed people had less migraines, and so then it was approved not just for seizures, but for migraines. And now it's come full circle because it's being developed and being used for weight loss as well. And then we have medications like beta blockers and other types of antihypertensive medications that bring down your blood pressure. And they're not helping necessarily because of the blood pressure, but they also just seem to prevent migraines. Sure. Then we have medications that are antidepressants, especially medicines like tricyclic antidepressants, medications like amitriptyline, nortriptyline, Elavil, and Pamelor, which we use to prevent migraines. But now, starting in 2018, we're in a world where we're having prevention that's really geared specifically to migraine. And so what we found is that there's a chemical in your blood that goes up when you're going to be having migraines. And it's called CGRP, or calcitonin gene-related peptide. And what we started thinking about was, well, can we block that peptide? Can we block that protein that's in your blood? And by doing that, could we try to prevent the migraines from happening? And so at first we tried to do it by doing what we call an antagonist, something that fights against it. That medication had some issues with liver, and so it wasn't developed. Now there's going to be future ones. But what's happened in 2018 is we started seeing medications that are called monoclonal antibodies that actually stick either to the receptor, to the part that the CGRP connects to, or to the CGRP itself. And by taking those medicines as self-injections, subcutaneous injections with auto-injectors, and by taking the medications, some are monthly, and there's another one that's actually monthly or quarterly, so so you don't have to take it every month necessarily. By doing that, what you're doing is you're preventing those migraines. And so that's an exciting time because we're doing that. We even have for people who have chronic migraines, people who have migraines more than 15 days a month, we even have treatments like botulinum toxin, like Botox, where we do injections, and by doing those injections every 3 months, what we're doing is we're preventing those chronic migraines from happening.
So there's a lot of things out there now.
There's a lot of things out there, and that's just the prevention. There's what we do when you have the headache itself.
Right.
And so it's really an exciting time in migraine treatment.
I know that new medications came out in the last few months by some of the pharmaceuticals that are making MS medications, and can you tell us anything about those?
Yes, so the medications I was talking about, those medications that are monoclonal antibodies, are the medicines that actually, some of them are from companies that actually make medicines for multiple sclerosis as well. And so by having those medicines, by having the medicine Aimovig, by having the medicine Jovi, by having the medicine Emgality, these are medicines where you're doing a self-injection to try to prevent the migraine from happening.
Well, thank you very much for being here today.
Thank you so much for having me.
It was an awesome interview and awesome questions and answers, and I'm sure many are going to benefit from this, and I just can't wait to get the word out there. So thank you again for being here tonight.
Thank you for having me.
Okay, everybody, I am back. I like that interview. I thought that was a really good one. So before I bring Dr. Kanter on, I just want to tell you all, I'm getting your emails and your questions through my email, but there is you should see a little orange arrow on the top corner of your screen. If you click on that, it'll make your question box available, and you can just type your questions in there for me, and I'll be asking them directly to Dr. Kanter. So without further ado, I'd like to welcome Dr. Kanter to MS Neuro TV. Hello, Dr. Kanter.
Thank you so much for having me.
Absolutely.
I hope everyone had a nice Thanksgiving.
Yes, and we hope you did too. Thank you for being here with us tonight. So, Dr. Kanter, we had some great questions coming in, and I'm just going to start with here. I have a question from Kate who's asking, can MS infusion medications trigger somebody's migraines?
That's an excellent question. When we think about migraine and MS, it's not just that we think about are they connected or not. We have to also think about a side effect from the different medicines we use for MS. And traditionally, as many or all of you know, we started with the interferons, started with injectable medications, we moved to IV medications as well as oral medications. And many of the medicines can potentially have migraine trigger as a potential side effect. Now, the question was specifically about MS infusions. And so when we think about infusions, there's a medicine that hardly anybody in the United States uses called Novantrone or Myosantrone. And then there's a medicine called Tysabri or Natalizumab, and that medicine is given monthly. And then there's a medication called Lemtrada or Alemtuzumab, and then a medication called Ocrelizumab or Ocrevus. Now, while the medicines that we call monoclonal antibodies, meaning one thing that sticks to another and directed against different aspects of the immune system in MS that we talked about, so Tysabri, Lemtrada, and Ocrevus aren't usually thought of triggering migraines. It doesn't mean that they can't be migraine triggers for specific people. And especially around the time when people are having the actual infusions, sometimes people feel yucky or just don't feel right. And that can certainly make someone not feel well and even trigger a migraine.
Okay. Heather is asking if a person's taking Aimovig but only getting migraine relief half of the month, what do you recommend?
So if a person's taking a medication called Aimovig, which is a monoclonal antibody, but not a monoclonal antibody that's directed against part of the immune system to fight MS, but a monoclonal antibody against CGRP or calcitonin gene-related peptide receptor, and it's been FDA approved for the prevention of migraines. It doesn't mean that it's going to miraculously cure everyone's migraines, just like any medication won't miraculously cure everyone. There are people who have amazing response and people who have less response. But if you've had a reduction where you've cut out half of your migraines but still not more, then the discussion has to be, should you be on another medication as well in combination to try to prevent those last amounts of migraines? And that's a great discussion to have with your doctor, with your nurse practitioner, with your physician assistant, to talk to them about, well, are you getting as much benefit from it as you would like to?
Okay, great. Thank you very much. And I have a question from Kate who's asking, is sensitivity to sound, but without head pain, a prodrome of a migraine or just the beginning of a migraine?
The question was about whether sensitivity to sound without the headache, whether that's a warning sign or something that happens before a migraine happens. Sometimes people with migraine have that sensitivity, have the sensitivity of light, sensitivity to sound, sensitivity to smells, and they may have it during the headache, but they may have it even before the headache. And so it definitely can be in some people kind of a warning sign beforehand that they're about to have a migraine. Now, remember, sensitivity to sound can also just be something that's separate to a migraine. And so if you're having sensitivity to sound that you're never followed by a headache, it may not be a symptom of a migraine.
Okay, great. Thank you so much for letting us know that. Someone's asking about Botox, using the use of Botox for treatment of migraine, and is there a risk for people who are living with MS to use Botox in triggering their immune system or starting a relapse from Botox?
Botox or botulinum toxin type A is a botulinum toxin. So it's not an actual. It's not like having botulism, but it's the same idea in terms of it's that toxin. And in the case of migraine prevention, what happens is that it's FDA approved for chronic migraine prevention by doing injections in 31 sites in the front of the head and the back of the head and neck.
Mm-hmm.
Even if somebody were to get the entire dose of their Botox injected straight into their veins and not under their skin, it still wouldn't cause weakness everywhere, like we think of with somebody who has botulism. And so, although there have been reports of what we call distal spread, meaning that the medication spread its effect from one injection site to another, it doesn't look like it's dangerous for people with multiple sclerosis. So we don't think of injection of Botox for migraines being dangerous for people with MS. Now, we also use Botox in people with MS for other reasons. We use it for neurogenic bladder. We use it for people with bladder issues, and we use it for spasticity or muscle tightness. And it can have beneficial effects for people with MS in those cases as well. Of course, Botox, like any treatment, can have potential side effects. And the most prominent side effect that we think about with Botox is that you're causing weakness to muscles. But you're causing it to the muscles that you're injecting. And so in the case of migraine, you're injecting it very superficially, and so we don't think of that as having a bad effect on people with MS.
Okay, great. Thank you so much for letting us know that. And I know you talked about some triggers. Somebody's asking about coffee or caffeine with migraine. Can that help people who are feeling a migraine come on or a headache come on? Is it different between the two?
There's a double-edged sword of using caffeine with migraine. On the one hand, caffeine can be a treatment for migraines, and in fact, some common headache medicines that people get over the counter have some caffeine in them. But also, if you start taking too much caffeine and then you stop, then you can have what we call caffeine withdrawal headaches. And so you can start to have more headaches because you're coming off the caffeine. And so you may rush to say, well, then I'll just take more caffeine. The problem is that then you get into this you get into this kind of circular thing where you're taking more caffeine, and more caffeine, and you're causing yourself problems. And so we don't usually think of people trying to treat migraines with caffeine, although certainly if you feel like, oh, I didn't get my cup of coffee that I'm used to, and now I'm having a headache, well, then drinking that cup of coffee might get rid of that headache.
Yes, absolutely. I understand that. Any natural remedies or things that you know of, complementary aspects, someone is asking about peppermint that you know could help with headaches or migraine?
The field of headache is actually very open to the idea of complementary alternative medicines. Many of the things that we do actually are based on complementary alternative medications. So we use magnesium, we might use riboflavin, we use something called butterbur or petasites. And so there are a lot of things that we can do, a lot of kind of natural treatments that can be used. What I would caution everyone when you're looking at your natural treatments is just make sure that you tell your doctor which natural treatments you're on, because although something may be natural, it still can have effects on the body, and that's actually probably why it's working. And so a lot of the natural treatments can also affect the liver, and you may be taking other medications which will affect your liver, and so you want to be careful with that as well. But the world of migraine is actually very open to the idea of natural things. In fact, we're also very open to the idea of things like acupuncture and acupressure. In fact, when you press your hand in that web between your thumb and your index finger, there's actually a pressure point there that is actually pretty useful for people with headaches. And it's kind of nice because you can squeeze it without people noticing that you're squeezing it. So when you have a headache and you're in front of a crowd, you can actually squeeze that area to try to relieve that headache a little bit.
Oh, I love that. Thank you. And someone is also asking, are migraines cyclical, like is it seen the same days of the month or same time of year, seasonal? Is there any connection to something like that?
Migraines certainly can be very cyclical. In fact, a common type of migraine is actually related to a woman's cycle. And so around the time of their period, a woman may have more migraines happening, and so it may be very, very cyclical. There's also people who feel very attuned to the weather and can feel the barometric pressure changing, and know because they're already feeling differences in their head pressure, and they may be feeling a migraine come on. Then there's also different times of the year where there may be more allergens in the air, and so people will feel more migraines coming on. So it's a very good question because migraine in a lot of ways can be very cyclical.
Oh, so interesting. Thank you. And what about early signs of migraine? Is there, if someone is experiencing and familiar with their early signs, is there a way to stop it before it goes into full-blown migraine?
The best time to treat a migraine is actually very early on. And so if you know that you're having a migraine coming on, if you have a medicine that your doctor is giving you, not to prevent the migraine necessarily, but a medicine that we call an abortive medicine, the medicine to actually knock out the migraine, taking it earlier on may be even better than taking it later on. And so it makes sense to talk to your doctor about how early can you take that medicine. Of course, it's going to depend on the medicine that you're taking, but actually knocking out the migraine as early as possible is actually a great thing to do. Another thing to do is to stay well hydrated if you feel one coming on. Try to relax yourself. Try to do some breathing exercises. Try to make sure that you're in a calm environment with less stimulus, less light stimulus, less sound, less strong smells, to try to see if you can try to knock out the migraine even before it comes.
What about vertigo and confusion? For someone living with MS, can migraine cause, or can someone experience vertigo and confusion when having that?
So there is a type of migraine where it affects more the base of the brain, and sometimes those are called basilar migraines, and those can be associated with symptoms that come from the brainstem, things like vertigo, like the spins. Now, a person with MS may have vertigo for other reasons. They may have vertigo because of the multiple sclerosis itself, but if it's coming on and it seems to be associated with a headache each time or most of the time, then it may be that you're describing a headache with vertigo as well. Now, confusion can happen with anybody's migraine. Certainly when someone's having a migraine, it's a lot harder to be as sharp as you are without a migraine because, frankly, it's distracting. Just like pain anywhere in the body could be distracting. Imagine even if you're a person who doesn't have migraine, imagine how pain in your head would actually be even more distracting and could make you even more confused. But if you're having other types of confusion, it makes sense to talk to your doctor and make sure that what you're really describing is the confusion of migraine and not something else.
Oh, absolutely. Thank you. Someone during your interview, you mentioned lesions on the brain similar to MS with people who have migraines. Somebody's asking if you could possibly explain that a little bit further?
Absolutely. So a quarter of people, so 25% of people with migraine actually have white spots on the brain. And this is not people with multiple sclerosis. This is just people with migraine. MS is not the only condition that can cause white spots to appear on the brain, and migraine is another one. We don't fully understand whether these are scars from the migraine itself, or whether these are cause the migraine, or whether they have nothing to do where one doesn't cause the other one. But we do see in people with migraine, we do see white spots in the brain. And one of the difficult things as a neurologist sometimes is differentiating in a person who has some non-specific symptoms, and you're trying to figure out if they have MS, but they also have migraine, they have white spots. The white spots may be part of migraine. In fact, in a person with MS, one white spot might be because of MS, the other white spot might be because of migraine, and the white spot might be because of high blood pressure. And sometimes it can be very hard to differentiate and to know what's causing what.
That's amazing. Thank you for clarifying that. Okay, a burning question: alcohol and triggers for migraine. Is there any alcohol that's better than other alcohol? We've heard red wine. Any recommendations, or just avoid alcohol altogether?
Well, alcohol is not a friend to a person with migraine. Alcohol can really trigger migraines, and for different people, it's going to be different types of alcohol. It's going to be worse. Certainly, for a lot of people, sulfites and things that you'll find in different wines will be a problem. The tannins that you'll have in red wines can certainly trigger migraines in some people, but some people are triggered more by white wines, or more by beer, or more by hard alcohol. It's really a good idea to try to limit your alcohol use as much as possible.
Okay, thank you. And I'm going to wrap it up with a final question. Could a migraine for somebody that's living with an MS be a sign of a MS relapse?
It's an excellent question. The question is, can a migraine, if somebody already has MS, can a migraine be a potential relapse of MS?
Yes.
And this is an unanswered question, but I certainly think that there are people with MS who migraine is their relapse. And we even have a reason why that can be the case. We know that there are parts of the brain, one of them is called the periaqueductal gray matter. And so this is in the brainstem, so in the base of the brain, the stalk that the brain sits on, in the area near where the CSF, or the cerebral spinal fluid, so that clear fluid is, there can be around that area, if there's an MS lesion, it can also cause a migraine. There actually was a paper just several months ago that found that there are areas and lesions on the actual covering of the brain as well. And we know that the covering of the brain is actually where migraines come from, not the inside of the brain, as much as the pain receptors on the covering of the brain. And so there are certainly some people who relapse can be, where migraine can actually be their relapse of multiple sclerosis. Now, of course, migraine is also just very common, and so it's not like you should be thinking every time you have a migraine, oh my God, this is a relapse of MS. But there are some people who that certainly is their relapse, and usually it will be accompanied by other neurologic symptoms.
Well, thank you so much, Dr. Kanter, for joining us tonight. We really are very appreciative of what you've shared with us tonight. Thank you for being with us.
Thank you.
Okay, and I'm just going to wrap it up with some closing words for tonight. For any of you who are curious and would like to join us again next month, we will be having Mindy Eisenberg join us, and she will be talking about mindfulness, meditation, breath work, and relaxation. I'd like to thank you all for joining us. Thank you, and please follow us on YouTube. You can find us on Facebook and on Instagram and Twitter, or you can visit us at www.msvn.org. We hope that you'll be able to return next month for our mindfulness, relaxation, and breath work with Mindy Eisenberg. And if you have any questions, feel free to email me. Thank you again for joining us tonight, and have a good night.
Awesome.